Hi, I'm Mark Scherer, the CEO and founder of Encompass Life and the host of the Wellness Revolution podcast. Today, we have Dr. Robert Graham, and he prefers to be known as Doc Rob. Dr. Robert, Dr. Robert, Doc Rob. How you doing, Doc Robert?
Dr. Rob the chef.
Dr. Robert. And he's also a chef, which is really unusual. And he is merging the worlds of nutrition and medicine in a very unique way to produce results with his clients. And so he's working on a preventative way rather than treating the disease after it shows up. And so, welcome to the show, Dr. Rob, and welcome. And love to
Thanks,
hear
Mark.
more about you, sir.
Yeah, thanks so much for having me. And I love the sort of the nature of your revolution because I think healthcare is in the midst of a not an evolution but a revolution where people just want more agency in their own healthcare, and they're not finding that in their doctor's office.
Yeah. So you're a, a chef
Yeah.
and also a Western medicine doctor, and you have a family practice. Is that correct?
Yeah, so I'm a trained physician, 25 years of experience in internal medicine, integrative medicine. I've done training in lifestyle, botanical, mind, body, and culinary medicine. And I'm also a chef. And I was a doctor for about 15 years and realizing that most of the diseases and problems that we face in our country are directly related to our food system. And to better understand food, I had a choice, either go to become a dietitian or become a chef. And I chose to become a chef because those are the people that feed us
Hmm.
food, not
Hmm.
nutrition, right? And I
Hmm.
think that connection between our food systems and our health systems, I believe will be the sort of the next big movement in healthcare.
Awesome. And and perfect timing for it because the costs of our healthcare keep going up and the effectiveness keeps going down.
Yeah,
And
exactly.
it's time for the body to really take people to really take care of their body and start thriving here in this country again instead of just barely getting by on surviving and taking one more pill to kind of get back to where they can live with it or whatever.
Yeah, and I think there's a false sense of security by taking pills because, biomarkers and labs look better. But all they do is change the numbers. They don't change the health and well-being of the person. Not minimizing the role of medicine in today's world, right? Because we are a very sick country, and without medications, we would be, worse off. But at the same time, there has to be an on-ramp and an off-ramp. And the idea of a medication was supposed to be that. It was supposed to be an intense therapeutic approach for a disease that is preventable, reversible, and treatable, not manageable. But we have decided that we're just going to, continue eating wherever we want and take the pills to make those numbers better. But a lot of the chronic diseases that we face in America today that are exploding in terms of healthcare dollars, but also just last week, you saw the studies that 75% of America is either overweight or obese. And so that's not a good recipe for success. And so I believe it's time that we work together with our doctors through a different approach, a fresh approach. And that's what we started. We started a fresh approach. And if I may, just talk a little bit about our approach, because when you come to see us as a doctor, we address your food, your relaxation, exercise, sleep, and happiness. And I always ask anyone I speak with, when's the last time your doctor actually talked to you about what we call the five most important ingredients in your recipe to health? As a practicing physician today, it doesn't always occur in that 15-minute visit. And so a lot of that learning has to happen on your own. And that's why we built a corresponding online school to support our philosophy of fresh. And I encourage everyone to sort of take the free course, learn more about a fresh approach to healthcare, and bring that knowledge to the doctor visit with you, because I can tell you this. Many doctors want to do this, but because they work within a very confined, volume-driven practice model, where they have to see a lot of people to sustain themselves, they are actually, and I believe, want to sort of have that patient come in as an informed consumer. And you're seeing the explosion of AI too. ChatGPT AI is going to change healthcare because you are armed with that knowledge of what you're dealing with before you even get into the doctor's office. So I'm encouraging my doctor friends to learn how to use AI and ChatGPT with your patients instead of starting to fight it. I think you're on mute.
What do you think the effects of AI are going to be on healthcare? Where do
Well,
you
I,
see it
I,
going?
I I think it's another tool. I think, particularly given, as I said before, the rapidity of that patient encounter,
Hmm.
we need an informed patient base to come in. And then just last week, there was a recent study saying that ChatGPT outperformed doctors. There was some fallacy to that. But if you open up ChatGPT and you put a host list of symptoms, your ethnicity, your body weight, your dietary preferences, your symptoms, it will pump out a diagnosis and a treatment plan for you. And so I think as a doctor, I'd love your input into your treatment plan. I always tell my patients, I'm just your Sherpa or your guide in your health journey.
Yeah.
And it really is an informed, engaged consumer that will be the patient of the future.
Wow. Wow. That's a interesting prediction. I like something you said when we were talking earlier today too. You said health is a verb, which
Yeah, yeah.
that's the first time I've heard somebody speak it that way as well.
Yeah, because again, I think health is a verb. It's an action. You
Yeah.
have to go and pursue it.
Yeah.
Just similar as the Declaration of Independence says, the pursuit of happiness.
Yeah.
Happiness just doesn't happen to you, right? We have to
Right.
seek it out. And if we're not in a space that we can actually identify um, the tools to be happy or to be healthy, that is when we are asking for help. And that's typically when you go to your doctor. But I think there's a movement happening in medicine too that there is a beginning of a shift from, again, from treatment to prevention. Um, the biggest problem we have is who's going to pay for it.
Yeah.
And eventually the old adage, either you pay the doctor now or the farmer, you pay the farmer now or the doctor later.
Right.
And I think it's time that we start of taking control of our own lives. And there's many sort of this, social determinants of health that impact this. But I
Hmm.
also believe that we all have the ability to advocate for ourselves and want more for ourselves, despite being, um, in food deserts and in socioeconomic deprived neighborhoods. We all have a way that we can take care of thyself better.
Right. Hmm. And I mean, this is something that's kind of unique the way you're doing it. I'm just you're the first person I've seen that's actually doing it with a chef and your background.
Yeah.
What has you? Was there a pivotal moment in your life or in your practice that went, I got to do it this other way? Like the way I describe it is there's like a burn comes up inside you, and you can't live that other life anymore. You got to do what's inside here, and it's going to take over, and it's going to come hell or high water. You got to get it out.
Yeah. Well, I think, oftentimes, in the corporate world, we call that burnout, right? There's and you're stuck in it, and that's
Right.
what's burning you out, right?
Right.
I believe burnout is your soul speaking to you, right?
Yes, sir.
You got to get out, and unfortunately, that is happening up here, in your brain, but your feet haven't caught up.
Yeah.
Um, and once you decide that I can't do this anymore, I have to do it a different way. Listen, there's no doubt. You go to the hospitals, right? Let's just go to a hospital. You go into a hospital, they serve you the worst food possible, the same food that got you into the problem. And the people in the
Or
hospital
worse.
or
Or
worse, right?
worse. Yeah.
And so for me, that was sort of a wake-up call that I had to do something to start changing. And so we started the first rooftop garden on a hospital in New York. I became a chef because the biggest problems we have is what we're putting into our bodies. And again, I had a choice. Either I studied global nutrition with the Masters of Public Health, but I needed more day-to-day knowledge on why this food find itself on our plate. And that led me down this whole path of policy, but more importantly than anything, the role of the chef in healthcare, I think has been marginalized. And I think a lot of chefs today want to go beyond the fat, butter, and salt and really want to explore a more, let's say, more sustainable way of cooking
Hmm.
that relies less on meat and more on plants. I'm never telling patients what to eat, but if you're going to eat something, I say eat more plants, eat less meat, but if you're going to eat meat, make sure it's good meat. And I think that's where we have to start thinking about where our sourcing of our food comes from, because our food system is also horribly broken, and it's not intended for health. It's intended for volume. similar to our healthcare system.
Hmm.
And that's part of the reason why I became a chef, is that I felt that if I was able to work with chefs and the food community, I can start designing meals that are healthy for
Well,
you and prescribed. And that's part of the reason why I work with a company called Performance Kitchen, and I'm down in DC. This is something that's really interesting. Many Medicare Advantage companies today have a food as medicine intervention, either in the form of a medically tailored meal, a produce prescription, nutrition, or culinary education that is paid for by you because you've joined that Medicare Advantage program. And throughout the country, there are demonstration projects in Medicaid that are doing the exact same thing. The problem is that the insurance companies are not telling you about them, and you don't know about them. And so I urge you to, advocate for yourself, call your MA program, MA plan, Medicare Advantage plan, and say, do I have a food benefit? And if you can't do that, then go to our website, performancekitchen.com, and put in your name and your zip code, and you will identify places where, in companies that cover medically tailored meals today. So it's power into people,
wow.
power to the people.
Man, I'm getting educated, quite an education with our conversation here.
Oh, thanks,
Amazing.
man.
Yeah, I thought all the insurance companies were basically against this, but what you're saying is they're starting to get on board with this.
Yeah, well, it's a competitive landscape out there, right?
Right.
And so the way an insurance company works, right? They want sort of high star ratings. A high star rating makes them more attractive to a potential consumer. And so the more bells and whistle, it's like a car, right? You can get the base price for this, or you can get the sunroof and the tires and
Yeah,
the
yeah.
whatever it may be. And so they want a lot of those accoutrements or those benefits.
Right.
And because that will make Mark choose this plan over that plan.
Yeah.
And one of the number one requested benefit among seniors is food access.
Wow. So, do you have people? I know you work with companies, mostly you said Fortune 200 companies, um, but you have individuals come into you from all over as well to get have your services.
Yeah, one of the things it's hard because I have so many, I wear so many different hats. And in fact, right now I'm sitting at a large health system here in New York that is trying to make this holistic approach to healthcare
Hmm.
reimbursable by insurance. And so this sort of holistic approach at this health system that I'm working for right now is taking patients' insurance. And the bet is that if we spend more time and look at patients more holistically, we're going to be able to bend that cost curve
Hmm.
within a year. I don't think it's going to take that long. If given the
Hmm.
right tools, you can build a house pretty quickly. And
Hmm.
I think that's what we've missed out. We've never given patients the right tools and time to achieve their goals that they want.
Gotcha. Beautiful, man. Um, I do have one other question I ask
Sure.
everybody before they get off the call, and the question is, what do you really love about life?
What do I love about life? Waking up in the morning. I think that first sort of when you crack those eyes open, that means you have an opportunity to change.
Wow, that's your first thought of the morning. That's
Yeah,
awesome.
let's take
Sometimes,
care.
sometimes I do that. Sometimes it's like, what again?
No, I think it's I live in a sense of gratitude,
Yeah,
and I just think that if you're alive and you can walk, you can talk,
yeah,
you're at an advantage to many people who can't.
yeah. And health is wealth. And if health is a verb, then so is wealth.
Absolutely, absolutely. And
Yeah,
you can, and I think you can tie both of them in.
yeah,
But doing the right thing
yeah,
for the right reason will give you the right amount of money you need to live a happy
yeah.
and healthy life.
If your body's not functioning properly, neither are your thoughts. It's a
Yeah,
direct,
amen.
yeah, there's a big relationship to that as well.
Yeah, so I encourage, I think, the way we approach both our patients and our clients. And if you can't, listen, I think coming to see me, that's one thing, as a physician, but really the explosion of online learning. One thing I say about us is that we are the art and science of health, right? Is
Hmm.
that in today's world, there's a lot of opinions, but I do believe education, degrees, credentials matter. And I think the buyer beware, because there's a lot of people with large platforms that are not necessarily talking about the best science and the best reasons for your well-being. And we just
Sure.
have to be, we just have to be, let's say, a knowledgeable consumer of knowledge.
Yeah. Well, Dr. Robert, pleasure having you on here. I would like to have you back and talk about your chef, about what you're doing with the chef, and also correlate that with with the company for the medicine food. See if you're up for that. I'd love to have you back on that.
Yeah, for
And
sure.
thank you so much for being on the show. And I really appreciate what you're doing and bring what you're bringing to the medical world. This is beautiful, sir.
I thank you for the opportunity, and I always end by saying, stay fresh.
All right. Thank you, sir. Have a beautiful
Take,
day.
take care.